Hello, everybody, and welcome back to another episode of Let's Talk About in MCO. So obviously, it's Thursday, April 30th. We are in day 42 of MCO. Tomorrow is a public holiday. It's May 1st, but it doesn't feel like anything. Obviously, I'm with Alex again today. So Alex, how are you?
Hi, not bad. Still keeping myself safe and sane.
And both of us are sporting like really not bad beards. it's the MCO beard. He's safe at home. I'm again in the office because, like I said, doing recordings in the office is much easier for me. And welcome to the show. So I just wanna let you guys know. Thank you very much for watching. We are on podcasts. If you wanna listen to us instead of watch us, we're available on Spotify. We're also available on Apple Podcasts. I just want to announce to everybody, we're now available on Apple Podcasts. So just search for Soya Chin Chow. The show is called Let's Talk About, and we're there. So, welcome to our show, LTA. Today we're going to talk about contact tracing applications. So, one of the key components in curbing the spread of COVID-19 is having a really good contact tracing application. We see case studies of this happening in South Korea. We see case studies of this happening in China. But one of the big things that you sacrifice when you install contact tracing applications is that privacy might be, foregone, because the contact tracing app needs to be location aware. That means it needs to know where you are all the time, just in case you come into contact with somebody that has COVID-19. To some people, that is a huge deal. So in Malaysia, we are now starting to implement some degree of contact tracing. The application that we're using is called Gerak Malaysia. This Gerak Malaysia app has an interesting story, and Alex has been covering the whole development of Gerak Malaysia from what it was and what it is used for now. The show today is going to talk about, okay, what is contact tracing, what is Gerak Malaysia, what's so controversial about it, and then also we're going to talk about whether we are okay to sacrifice privacy for the sake of, I don't know, sanity, in that we can all now start going back to normalcy and going back to our day-to-day lives, and not being stuck at home under movement control order. All right, so Alex, okay, let's start from like the really basic question, because I really want to get into the more interesting topic, which is like, what is the story behind Gerak Malaysia? Because there's a lot of issues with it, but we'll get into that later. But the most basic question right now is, what is Gerak Malaysia?
Gerak Malaysia is a contact tracing app that's actually developed by the MCMC, the Malaysian Communications and Multimedia Commission, and this is actually backed by the telcos. So we wrote a story about this about 2 weeks ago, so on the 17th of April. Initially, this is supposed to be a purely simple app that does contact tracing. And before this was introduced, there were other apps as well, like there is a My Suggestion app, and also KJ through MOSTI, through the Ministry of Science, Technology, Innovation. They're also developing another contact tracing app that uses Bluetooth. And how is Gerak Malaysia is different is that it uses location-based tracking. So it actually uses your GPS information to track where you've been, as opposed to the others that's using purely on Bluetooth technology only. After the app was so-called revealed publicly, and people can start downloading and all that, interestingly, the next day, the National Security Council made a tweet saying that, this Gerak Malaysia app has not been evaluated and it's not even endorsed by the National Security Council. And even KJ jumped into it and said, this app is not approved because it uses location data. All of this suddenly had a very interesting turn when the government starts to announce that, we're trying to ease the restriction order under the MCO. So I think one of the latest developments that those who left for the hometowns before the MCO can start to apply for permission to return back to the city. In order to track the number of people who are planning to do the interstate travel, the police is actually using Gerak Malaysia as another channel to request for permission. So that's interesting. So from an app that NSC says that, this is not endorsed, now it becomes like the de facto app for anyone they wish to apply to travel interstate.
There's like a lot of interesting stories here. Obviously, number one is KJ. So KJ was, I believe, the first one to announce that Malaysia is working on a contact tracing app. He was the first to come out to say that. And then after that, quietly, you saw the Gerak Malaysia app be available publicly in the Google Play Store and Apple App Store, and you could download it. And Alex, you wrote the story about it, and then immediately right after that, MKN came out to say, "Oh, this is not endorsed." And then KJ also came in and because a lot of people were asking him on, or what does he think about this application, and then he also said that, oh, it's not approved because it traces
location.
It traces location. It tracks your location. But here's the thing. I mean, the master user, or the person where all the app developers need to care about, is Ministry of Health, or at least the Director General of Health, because he would know, okay, how he wants the function, and whether contact tracing is useful or not if it's not location aware, or if it is location aware. And we talked about this in our previous LTA episode. You can find the link in the description below. Contact tracing applications only work, and you can see this in case studies in South Korea and also in China, it only works if it is location aware. There's no buts or ifs in terms of whether you can use Bluetooth for this to work or not. I've read reports that Apple and Google are also working on a contact tracing application, right?
Yeah, there's a contact tracing platform, and they're going to release API for developers. So it's actually quite similar to what KJ is working on. So it uses Bluetooth. There's no location information. So yeah, this is a bit different.
Well,
and that's only going to be available next month.
Yeah, but I find that quite weird. Okay, so Apple and Google are working on a contact tracing application. And obviously those are companies in the United States. And when the news broke out that Apple and Google are working together to develop a contact tracing application, a lot of the politicians out in the United States were saying that, oh, this is an invasion of privacy. I find it weird, okay, because Google, at least, okay, maybe not Apple, but Google knows almost everything about you.
Yep.
So
your location data, they know exactly where you've been, how many times you've been to a shop, how long you've been there, even Facebook as well.
Yeah, so they trace your location, whether it's anonymized, meaning that they know the location, but they don't know who that person is that's there, or maybe it's not. But the thing is, that data is already available. I don't see why it's being a problem. Every time you use Google Maps, every time you open Facebook, every time you open Waze, every time you open Instagram, Twitter, those applications will know where you are. So location awareness is not. I mean, maybe I'm not seeing it the way how people are seeing it. Maybe I'm not seeing it from that perspective. So if you guys are listening, or if you're watching, maybe you can educate me on what is this concern about applications knowing where you are. Maybe I'm just like a normal person and I go to normal places. I'm not a VIP. I'm not a super secured person. So I don't know what is the concern.
I think one of it is that people don't trust their governments. But the thing is, the government knows a lot of information about you already. So if you're okay with your information being used by third-party companies, by people doing advertising, how come you're not okay with the government when the government already knows your income, your EPF, your immigration status, everything? They have more information already. So what's the difference?
I mean, okay, this is the sentiment that's coming out in the United States lah. But if you've been following reports, you know that the way the United States are fighting COVID-19 is, I mean, for the lack of a better word, is very weird right now. Number one, they are the number one country with the most people that has COVID-19 positive
1 million.
cases. It's struck over 1 million. I think they also have the most deaths, and people are protesting. The people in the States are protesting about not wanting to stay at home because they're saying, oh, it's my right. I want to walk wherever I want to go. I want to stay outside. That's my right. It's my freedom. Obviously, one of the ways that we can end this crisis is to the development of a vaccine. And the timeline for the development of a vaccine is probably 12 to 18 months. What's happening in the US is that number one is they're talking about privacy. Number two, they're talking about freedom of rights and whatever. And then number three is about freedom to choose whether they want to be vaccinated or not. So the anti-vaxxer movement is also huge in the US. And I believe all these factors are contributing to the spread of the virus in the States. So I mentioned that because it's a good juxtaposition with what's happening in Asian countries. So the two successful countries, China and South Korea. So China is a bit more what's the word I'm looking for? It's not communist. It's more authoritarian.
Yep.
In terms of like, okay, when the government say you do this, very likely the people will follow because the rules are very strict and it's authoritarian lah. So that is one extreme case of how you can handle COVID-19. The other one is South Korea. It's more liberal, but the society there has a more communal mindset in a way that, okay, I am willing to make these sacrifices now so that I can have a better life 3, 6, 12 months down the line, like in the longer term.
Yeah, they actually think of the community, not just individual.
Yeah. So like in South Korea, and they are one of the best case studies I've seen with regards to how the right mindset and the right society and the right community really contributes to the success of combating COVID-19. So you see this happening in Malaysia also. So in the beginning, there was a lot of individualistic tendencies. Number one was a lot of panic buying, bread finishing in shelves. We don't have toilet paper finishing, so that's not really an issue. We saw the tendency to be individualistic. I have to give credit to the government. I have to give credit to a lot of the media, and also I have to give credit to Malaysians in general that we've overcome that. We've become better than ourselves. That we look beyond just us and our family. We look now to the community. So we see people who are not staying at home, people who are breaking the MCO ruling, being singled out. People are now like, hey, don't do like that. Don't be the idiot, And that's good because we're moving towards what South Korea has become. They are willing to sacrifice privacy. They're willing to follow the rules. They're willing to, susahkan diri sedikit as long as everybody in the community is protected. So nowadays they still wear masks. Social distancing is still a big deal. And I mentioned this in our previous episode. I'm also, the way I observe this, and again, viewers and listeners, if you're watching, you agree, you disagree, you have a comment on this, please put them in the comment section. Please let us know what you think as well, because this is my perspective. Maybe you have maybe if you're a doctor or you're a frontliner that's seen the front line, that has a different perspective of what's going on. I want to know, because that gives me more knowledge. And our other viewers and listeners, it gives them more knowledge. But what I'm seeing is that we are willing to make that sacrifice. We as Malaysians, we are willing to make that sacrifice. What's your thought on this?
I think as we enter like the fourth phase of MCO, I think people are becoming aware that why is this restricted movement is necessary in the first place. Because we are seeing good results right now. The numbers are coming down. I think for almost 2 weeks straight, we've been recording less than 100 cases, which is good. There are a couple of spikes in the past few days, and that's mainly from returning Malaysians. They come back. And like you said, right, initially people are quite defensive. They say, why are we doing this? Like, for example, when the government announced hotels as quarantine zones, some people are apprehensive, like, why are we wasting money on these people? Why can't they just quarantine at home? And the thing is, it looks like that move is actually very helpful in containing the spread of disease, because I think I don't have exact numbers, but 100 over students or Malaysians that came from overseas, they were tested being COVID-19 positive during quarantine, and that actually helped to reduce the spread. Imagine if these people isolate at home, and if let's say they have elderly or other family members at home, that could increase the numbers. So I think Malaysians, they begin to realize that, this move is good. I think other people are supportive of MCO. At the same time, if you want to go back to our normal life, we need to make sure that we bring down the numbers as fast as possible. And that's only possible if everyone adheres to the MCO directive. And even the Director General has emphasized several times, we have good numbers, but the COVID-19 cases may surge if somebody takes it for granted, if we put our guards down, if we think that, it's normal, it's less than 10, we can go out to, makan and mama, gather together and all that. The thing is, even after the MCO is lifted, we need to embrace a new normal. Social distancing is still a must. We still need to wash our hands frequently and all that. And I think it's time for us to get used with the new normal.
Okay, so it's interesting that you mentioned the new normal. So one of the elements, well, we should embrace the new normal until at least a vaccine is found.
Yeah,
Because once MCO is lifted, it doesn't mean that COVID-19 doesn't exist anymore. It's
yeah,
still there. And you've pointed it, domestic cases have gone down to below 30 or somewhere
yep,
around there. Yesterday it was so it's the 30th of April today. Yesterday Wednesday it went up to 90 plus, and 72 of the 90 plus cases were imported cases. Today I saw on the news, I saw on Malay Mail, I think a number of students from Indonesia, about 30 or 40 students from Indonesia that are flying back to Malaysia, before they boarded their planes, they were screened and they were found to be COVID-19 positive, or something.
yep. And they
And
denied boarding.
yeah, they were denied boarding. So that is like 38, which is like now the daily number of cases domestically. So imagine if those people came back and they were in contact with everybody else. The cases could easily flare up again to 100 to 200, and we're back again to square one. What is the new normal, right? One of the aspects of the new normal is this, not to say you being liberal with your privacy or your location, but it's to not to say sacrifice, because I don't know what's the word, because I don't feel that we should have an issue with location, because there are applications that know our locations intimately. I
Yep,
mean, I tell people, look, Google knows you better than your wife or your partner or your girlfriend or your boyfriend. And they say, why? Well, here's a simple test. Would you reveal your search history to your partner? I don't know. I don't feel comfortable doing that. What about you, listeners and viewers? Put your answer in the comments. Would you reveal your Google search history to your wife or your partner or your girlfriend or your boyfriend? I would think the answer would predominantly be no, or more politically correct as, okay, I'm not comfortable with that. But here's the thing, Google knows that about you. And Google
yeah,
knows where you are. Google knows what you're looking for. Google knows you more intimately than anybody else.
yeah. Also, they
And
have your contact list, your photos. They have all that.
your login,
Yes,
it knows your passwords because you let Google remember your passwords. And Google is doing that for the benefit of themselves. It's not the benefit of us. Mostly it's
yeah,
for them lah, not for us.
yeah. For us,
So
is they say convenience. Oh, it's so easy. Just give everything to Google. Let them handle it.
yeah, it's for the sake of convenience, right? So I I I mean, if you are still opposed to installing a contact tracing app because the contact tracing app will know where you are and you don't trust the government, I think you need to relook at your perspective and relook at your priorities. Yes, the government knows where you are. Will there be like a risk that the government will use this application to do other things? I don't know. I mean, we discussed about this, right, Alex? And there were some
Yep.
discussions about what the app is being used for and what the app is not being used for. Okay, what was the app designed for? So contact tracing is a very like generic term.
Correct.
So can you break down specifically what was the app designed for?
Okay, so the app is designed to be very lightweight from the start. So the sole purpose is to do contact tracing. So how it works is that it uses your location data and it traces where you've been. So how long you've been in the house, and then you go out. Let's say you go to the grocery store to buy your essentials. You go to the market. If you take public transport, you head to a workplace, especially if you're an essential worker. So that will be recorded through the app, and that's being sent to a secured server locally. So how this thing becomes useful is that, let's say, for example, if you're going through a roadblock, the police you can just scan the QR code that's generated from the app to find out whether are you safe, are you allowed to travel or not from the simple application. And the same thing goes with seeking for healthcare. So like, for example, hospitals, like we mentioned in the last episode, that there's a lot of irresponsible people, going to the hospital saying that, oh, I'm not in contact with any COVID-19 positive patients. And it turns out they are, and it actually affects the whole operations. So with this app, when you go to the hospital, you can just show the QR code, and the frontliner can scan the code and determine whether you're high risk or not. So if, let's say, you're going there for, let's say, I'm having a mild flu. So they can scan the QR code and find out, okay, based on your history from the app, they will know whether you'll be into a like high risk zone. If you are a high risk, they can assign you to a different lane to go straight to the actual screening. If you're safe, yeah, you can go to the normal outpatient admission. After the recent announcement that people can travel interstate, this app has evolved. So now it becomes more like a permission app. So right now, the first priority is to use this app for people to register permission to go interstate. Because I think we mentioned this before, that before the MCO was imposed on the 18th of March, there was like a huge like exodus, I think 300 over 1,000 people have left the cities to their respective hometowns because people think that
it's a holiday.
it's a holidays one, but of course they want to be stuck. It's like as if Berlin's making a wall between the city. So that's why people just rush back home without thinking about anything. And obviously with the recent lifting of the MCO, gradual lifting, so some services are open and some people need to go back to work. There is a need for these people to return back to the city. And in order to do that, the government needs to know how many people are coming back, where are they traveling, how many people are traveling. The manual way is to go to the police station. Of course, that was disastrous, like what we've seen before the MCO. People just rush to the police station in huge groups, and that's a very high risk of another exposure of COVID-19. So to make it more easier is to get people to download this app and to request permission from the app itself. Right now, the app is quite basic. So if you want to register to travel interstate, you just tap on the travel interstate button and they just register your interest. So right now, it's like a research interest. Eventually, there should be a new update which will request for more information like where are you right now, where are you traveling to, and also how many people is traveling with you. So that will be, I think, should be coming out pretty soon because the government will look into the data after 1st of May and then they will come up with the proper SOPs for the interstate travel because as of now, interstate travels are not permitted. And on top of that, as mentioned by the senior minister, Ismail Sabri Yaakob, the current ruling is one person per car. So you can't travel with your whole family right now. So a lot of things need to be done before they let people travel interstate.
But now they allow two people in one car, right?
Yeah, but that's only for essential shopping. So if you want to go to the shop to buy things from the supermarket, to buy medicine, you're allowed to do so. But you still can't travel interstate just yet.
Okay, so the benefit of having a location-aware app like Gerak Malaysia is number one, there's no ambiguity. You cannot lie where you've been. There's a QR code. So you download the app, you fill in your details, right?
Yep.
And then you agree
grant permission.
You grant permission for the app to trace your location, and then it will generate a QR code. So from the app. So this QR code is like GrabPay, right? That the utilization of the QR code is like GrabPay, in a way that if you go to checkpoints where the police or the hospital or even your workplace will require for you to scan the QR code, it's super easy to determine that you're from a green area, you're from a red area, or you've delivered in a red area. It just makes it faster, more convenient. There's no ambiguity. And it's secure, right? So it's developed by MCMC. You've mentioned that it's endorsed by the telcos. What does that mean?
So what I do know is that when they first roll out the app, they get all the telco guys to test it out internally within their staff.
It's not just because of testing, right? Or is this information that we cannot divulge?
I first came to know about it because I know some friends from telcos. They told me that it's been tested internally.
Okay, so telcos are involved because telco also have your data, right? Telcos know when you're connected to cell towers. They know what kind of websites you browse. They know all that, but it's information that they don't divulge, and it's not used against you. By the way, is this app does this app cover PDPA? Do you have like a PDPA disclaimer in the application?
I haven't seen yet, but I do know that this information that's collected from the app, right, is only valid during the MCO and up to 6 months after the MCO.
You can uninstall it if you don't want to use it, right?
Yeah. So in fact, actually, after the MCO is lifted and after the whole crisis is over, they actually encourage you to uninstall the app because it's not going to be used. And from what I know is that the information for the contact tracing is only going to be shared to MOH. And MOH, right? They actually have like this patient confidentiality. Yeah, they cannot use the information for marketing purposes and all that. Yeah, so essentially, the information is actually safer with them compared to Facebook and Google.
Yeah, because even with the people who have COVID cases, they don't reveal the names. They just reveal them as patient what the number
Yeah.
the number. So
Maybe the age and gender, that's it.
yeah, I mean, I guess it comes to the point that we're trying to make with this show today, right? What is contact tracing? Why is it important? What is this Gerak Malaysia app? So we know that contact tracing is important because we don't know the strangers, and sometimes even our family members, we don't know where they've been. We don't know who they've been in contact with, or whether they've been in the vicinity. So
Yep.
again, South Korea has a very good implementation of this. Once a person has been identified to be COVID-19 positive, right, the app will go into will trace back the location that this person has been, right, and
Yep.
alerts will be issued to everybody that's been within that vicinity,
At
and then
that
this
time.
yeah, at that time. And this data, I mean, the generalized version of this data is available as an API that allows website developers to use that data to create resource pages. So that allows, if you want to travel, so let's say if I do my groceries at Giant, for example, how do I know if that Giant has a person that's been COVID positive there?
Yep.
Right now, we only depend on news reports, which is not usually is fast, but not as fast. And then we also depend on Facebook and fake news, which is worse.
Correct.
So the data that's available will make this very useful for everybody. And if this is the new normal, if this is something that we have to live with for the next 6 to 12 months, I don't see why this is bad.
Yeah, and also nothing about contact tracing, right? Okay, imagine if there's no contact tracing app. And let's say this guy walks into the hospital and then he got tested positive. Obviously, the authorities will want to find out, where have you been for the past 14 days? Who can remember where they've been 14 days? I don't even remember what I had for lunch 2 days ago.
Yeah, that's a very good point. I don't even remember. Yeah, yeah, man. Yeah. That's good. That's good point. Yeah, and even if you don't want to lie, even if you want to tell the truth, you can't remember, and that just slows down the rate at how fast we can recover.
Yeah, because like there are some cases, I think it's really proved, it's really confirmed that people can spread disease even they don't show symptoms.
Yeah.
So imagine it's like 14 days, like where have you been? I can't remember. Which station have you been? What time you go to the station? You can't remember all that.
Yeah. And authorities need to know this, because then because they need to know where the case came from.
Yeah.
Yes, the daily announcement, the Director General talks about, okay, this is from this cluster, this is this cluster. There's one caveat there, and I think you all don't know this. The caveat is the data is only as good as the input that's been received.
Correct.
So it's based on a lot of, okay, I trust you, okay, I check, and there's a lot of discrepancy and human error available there. So I think what I wanted to set out to achieve when doing the show today was to make it clear that contact tracing is super important. Number one. Number two is contact tracing only works if it's location aware. Now, I am not as smart as the people in Apple or the people in Google that are developing another application that is apparently not location aware. And I don't know if there is any other way for this to work. There has not been, at least to my knowledge, a case study that shows how a community can work, or how can people survive COVID-19 without proper contact tracing. Either you are super honest or you're super good with your memory of where you've been. But an application that is location aware really helps with this. Now, the flip side of this is a Bluetooth contact tracing application.
Yeah,
So how does that work?
instead of getting like precise location information, it actually tracks based on proximity tracking. So it detects other Bluetooth devices that's near you. So there's a few drawbacks because of that. Like for one, if let's say you're staying at home, you could be tracing other Bluetooth devices, even your neighbor, especially if you're staying in an apartment, and they could be falsely flagged as a high risk person. And that only works if everyone installs the same app. So let's say, for example, if you go to like a rural area and not everyone has smartphones, you won't be able to get you can't even get much useful information because the density is actually quite low, because it only tracks based on close nearby Bluetooth devices.
Well, I guess the argument of whether you need an application can also be set for Gerak Malaysia lah.
Yeah, but at least if let's say I'm a positive case, at least they know where I've been. So let's say if you use a Bluetooth app, right? If everywhere you pass by doesn't have a Bluetooth device, then that information is missing.
Oh, okay. So what you're saying is that it require okay, so it's basically tracing via Bluetooth lah. That means it's connecting
Yes.
more dots because um if your proximity with this person has Bluetooth, okay, we know that you've been there. And then
In contact, yeah.
yeah, it's like how much of Bluetooth dots that you're connected to lah, right? I
Yes,
don't know whether I'm
correct.
describing this properly. Essentially, it's the same thing, but it's just another layer.
Yeah.
It's not a direct tracing of your location. And again, location aware and location tracking and location tracing is two completely different things. So location tracking is tracking you in real time. That means I'm here when I move out to go home. It knows that okay, I'm going home. It knows what road I take to go home
Yeah,
in
because
real time.
that's important because when you travel, right, you're going to be touching a lot of things. You're touching the handles, the handrails, doors, and those actually are very important things to consider because if you have that information and if the person is a confirmed case, the authorities can trace back and perform sanitation at those hotspots. That's the difference.
Yeah, yeah. So I don't know Bluetooth. Like you mentioned, I don't know if it's gonna work. Okay, Singapore has a contact tracing app, right? Do you remember
Yeah.
what's it called? I can't remember the name.
Hang on a second. It's trace together. Yes.
Okay, is
Yeah.
it location aware?
It's not. It's using Bluetooth. And the difference with Gerak Malaysia is that it doesn't send the information to a server. It's actually stored on the phone. So it's only used when I think when you go to hospital, then that's how they retrieve information.
Yeah. So when it's required, it'll be pulled out from your phone, lah, right?
Yeah, correct.
Yeah. So I know that the people who are developing this, and I know this for a fact, I know the people who are developing this, the people who are the minds behind Gerak Malaysia, have the best interests of the public in mind, because they are aware that they are going to use this application as well. So they've built in all these measures and restrictions to make sure that the app is as safe as it can possibly be. The other element that is an issue here, and it's already happening in the US, is that the application is being politicized. In a way that, okay, KJ came out to say that they're developing an application. I think he announced that he was developing an application
I think early April.
early of the MCO, and we haven't seen anything yet. To be honest, the application doesn't have to be super complicated. It's not a mapping app. It's not a Facebook. It's not a social media app. It's just an app that traces that keeps the data of where you've been, and when that data is being pulled out, the server will correlate that data with the data that it has of people that's been COVID positive in the areas that you've been. That's all it does. A lot of the processing doesn't happen on the phone anyway. It happens in the server when the data gets pulled out. I don't think it takes a lot of time to develop such an application. So I don't know what's going on with KJ's app. I mean, he announced it. He hasn't provided regular updates of what's going on, whether it's in beta or whatever. Gerak Malaysia wasn't announced. It came out of the blue. It came out of the blue from MCMC. Obviously, when MCMC developed this and allocated resource to the development and testing of this, somebody must have given the order to also tell the telcos, okay, telcos, we need you to test this. We need you to download get as many of your employees to download this. There must be a reason for that. On the flip side, also, there must be a reason why MKN quickly came out to say that this hasn't been endorsed. There must also be a reason why KJ came out to say, hey, this is not approved. I mean, he is in no place to say that because he didn't develop the app. He could very easily just say, this is something that's beyond me. I'm not aware of this, or I know the app exists. I've seen it, but I didn't develop it. I don't know who develops it, and
Or just simply say, I think you need to refer back to National Security Council.
Yeah, so for him to strike it down tells me that there is something going on. So MKN goes out and says, okay, it's not endorsed, and then KJ strikes it down. And then I think a few days after that, MKN goes out and say, oh, you need to download this app.
Yeah, which is weird.
And then PDRM goes out and say, oh, you need to download this app.
Even Asia also do that also.
Yeah, so Asia goes out to say, oh, you need to download this app. And all this doesn't happen automatically. There are people higher up there in the management or in the leadership that's saying, hey, we need this. There is like an element of this application being politicized. And the question is why? The simple answer is, well, everybody wants to be a hero. Somebody's gonna claim that they did something. And the most critical component right now, we have the healthcare professions. They are doing a wonderful job. We have the frontliners, the security people, the police, the
Military.
army, the Rela that's helping out, the Police Bantuan that's helping out. We have that. They are doing a splendid job. And then we have people in the logistics, right? The delivery people, people in MITI, okay, not splendid, but okay, they're doing an okay job, still allowing the economy to move on. My point is that the most critical component beyond health, beyond having a space and capacity to handle cases, beyond security and services, is contact tracing. And that component is not yet available in Malaysia. And that component could really turn the tides and could really make MCO shorter, much shorter than what it is now. Yep. Having a workable contact tracing application in Malaysia could be the answer to the next best thing to having a vaccine, to be honest. If I understand this correctly, people are just the powers that be are just waiting to be the one to claim that they develop a useful contact tracing application.
But what I believe is that whatever the possibilities are, contact tracing will allow us to resume back to like a new normal life. Like for example, I want to bring a point that in South Korea, right, they managed to contain the spread of the disease without implementing any lockdowns, and that's because of contact tracing.
Yes, without the MCO, because of contact tracing application.
Correct.
Yes, you're right.
And same time, you look at Singapore, they have the Bluetooth-based Bluetooth tracing. They launched that app, and a few years later, they know they couldn't control it. They had to implement their own lockdown, or it's called a circuit break. Yeah, CB, circuit breaker.
Yeah.
And what I read earlier is that after 2 weeks, right, the adoption rate is very low. I think it's like 10%, because there's no motivation for people to install the app. Like, why do you want to install this app? But at least for Malaysia, I guess the repurposing it for approval for interstate travel, I think it has helped make this app more mandatory. So I think more people are installing this app because they want to travel instead, and I think that actually helps to increase the adoption rate in Malaysia. And from what we've seen from the app, right, looks like in the near future, you probably need to use this app to pass through any roadblocks very soon.
I think what the Malaysian government is doing is like super smart. Or whoever that is like making the decision on this Gerak Malaysia app is super smart, because what they're doing is, like you said, in Singapore, people don't see the need, right? The adoption rate is low. In Malaysia, the adoption rate wasn't that great, but when we were looking at the application, we noticed that it was trending, right, in health and fitness, among the top 10 when it was first launched. That means the download rate is high for the period of time. And the government of Malaysia is being really smart because it's injecting a need for the use of this application. I need to move from my hometown to Kuala Lumpur or to a city. And because it's Ramadan or whatever, or because I need to move back because work is going to start soon. So MITI has just announced that businesses that are allowed to operate, essential services that are allowed to operate can now operate at full capacity or something like that. And it's smart because people are downloading. And I've read report, I think, Alex, you wrote it's about 100,000 requests, right?
I think that was on the after 24 hours. I think now should be
over 300,000.
I think 3 days ago it was 250,000 applications. Yeah.
So doing this manually, you will not have the capacity to handle things like that, right?
Yeah, because imagine if 300,000 people wish to travel for interstate travel, there's 300,000 people at a police station. That's going to be crazy. Yeah. And for police to do it manually by hand, that's going to be a nightmare.
Yeah. I don't know how many people we have in the police force, but it could very well be one person handling 10,000 applications at least. I'm just proud to be Malaysia because we're doing this so well. Like Singapore, I really don't know what happened, man. The contact tracing didn't work. You know why? The secret sauce here, right? The secret sauce here is the community mindset. So Singapore, the kiasu attitude, and they are very skewed to Americans. I mean, as a culture and as a society. Again, guys, if you disagree, this is just my perspective. If you disagree, put them in the comment section below. We're happy to discuss. This is let's talk about. So let's talk about, right? So I think Singaporeans are very individualistic, and because of that, and the society that is very individualistic will find it very difficult to fight COVID-19. I don't have the data, but I can see a trend here. So again, China, South Korea, Japan. China again is an outlier here because of the government, but South Korea and Japan, they are doing better because of the society. And I'm happy because in Malaysia we started with like an individual tendency, but the community is stronger now. I see a lot of people coming out. So I noticed early in the MCO, we started saying stay safe to everybody. Before we sign off, we say stay safe, and I think that's very sweet. I noticed that there's a lot more compassion to the delivery boys. So I see in my timeline, a lot of people are starting to, whenever they receive a delivery, they give them some drinks or some makan, so that it's just a nice gesture. And this sense of community and this sense of, okay, I'm doing this for the community even though it's troublesome for me. For me, this is like a beginning of probably a better Malaysia. And if this is the new normal, right, why not? It's a Malaysia that's less polluted. It's a Malaysia that's more pleasant because everybody's like more friendly. It's a Malaysia that have more space. That means when I line up, I don't get people pushing me from the back. Like, you pushing me from the back, it's not gonna get any faster, dude. Just look in front of me. So I don't know, man. I think it's gonna be better. And the other thing also about this new normal, right? I hate the term new normal because it feels like whether COVID-19 wins or not, it has defeated us because we've accepted this new thing which we call a new normal. I don't want to say that.
You call it temporary normal because eventually we will go back to our normal self once the vaccine is found.
And that's my point. My point is that not a new normal, but let's get back to normalcy. Like I mentioned in the previous episode, right? I don't want to talk about COVID-19 anymore. I don't want to how bad the economy is anymore. We are in the middle of it. We know that the economy is bad. We know that COVID-19 is going to affect us. But I want to talk about the future. I want to talk about, okay, what can we do now to make things better? What can we do now? What do we need to change? Not to talk about, okay, social distancing, not to talk about we need to wash our hands more. No. What do we need to change in the way that we live so that we can fight this, number one, and we can survive this, and we can survive this if it happens again?
Yeah, but I think moving forward, I think like what we discussed last episode is that I think this crisis has made everyone realize how important the internet is. So I think that's where I think the governments and authorities will realize that we should spend more in infrastructure. I think that's very important because there's still a lot of places in Malaysia that doesn't have access to high-speed internet. So that's something that I think governments everywhere should be investing in.
Yes, and that's another very good point. So even if you want to call this the new normal, right? The new normal means a more connected Malaysia. The new normal means a more aware Malaysia.
More cashless Malaysia.
A more cashless Malaysia. A more innovative Malaysia, a cleaner Malaysia, a Malaysia with less pollution. Yes, if that is the new normal that we all agree, then yes, I agree that I want to live in that new normal. But if we keep thinking like the new normal is like, doom and gloom, businesses are closing, we don't have a way to survive, we're waiting for our government to give us handouts. No, I don't want to talk about that. Because I'm not saying I don't want to talk about it because I'm not affected. That's a lie because everybody's affected. I'm affected.
Yep.
I'm concerned. I'm anxious. I have anxiety. I can't sleep. I mean, we're running our own business here, and it's everybody's affected.
So I think the topic should be what new opportunities that this whole situation has given us.
Yes. So I refuse to talk about the bad things because I want to look at what can we do, right? How can we make this better? So what is the point that we're talking about? So the point is, and we're almost running out of time. The point that I'm trying to make today is that The question is, how can we make it better, right? One of the ways to make this better is, if there is a question on whether your privacy is going to be sacrificed for the greater good, which is to defeat COVID-19 and to make MCO shorter, do not even discuss about it lah. Seriously, do not even talk about it. Yes, understand that, privacy. I mentioned in the previous episode, privacy is a construct. Rory commented that it's not, it's not. Yes, I agree, it's not a construct. I want to say that it's a bit more liberated. It's not. Yes, you need to protect your privacy, but if you're not doing anything bad, and if you're a normal person like me, and we don't go to brothels, or you don't go to places where you don't want your wife to know, then this is fine. This is fine. We have to do this. If there is a call for everybody to download Gerak Malaysia, or to download whatever contact tracing application that's endorsed by the government to make MCO shorter, embrace it and make it happen, and just do it, guys. So that's the point that I want to make in this show. Okay, so Alex, what do you think before we end the show?
Fully agree with that. I think, like how we mentioned, right, we should think about the whole community as a whole, not as an individual. Yes, some people have privacy concerns, but you think about as a community that this will help to contain the spread of disease. I think this is something that all of us should support it. Like what Dr. Noor Hisham said, right? A few criteria that we need to consider before we can lift the MCO, and one of it is our ability to control the spread of disease. And this contact tracing app is crucial in ensuring that. So if there's any new outbreak, we can find out who's affected, where they've been, and we can contain the spread even if MCO is lifted.
Okay, and with that is the end of the show, everybody. So just to recap, make sure you download the contact tracing app if you are required to do so. As always, we love to hear from you, your comments, your suggestions, your discussion. I mean, if you agree, you don't agree with the things that we say, with the things that I say or Alex say, let us know in the comment section below. Let's have a healthy discussion about a healthy, insightful, and informative discussion about the topics that we talk about in the LTA. I mean, that's the idea of the show, is to get everybody to be in a better state than before. So if you come to watch this show without the knowledge, and you go like, oh, I didn't know that, and then you left with more information that you came with, I'm very happy with that. Or if we are putting information that's not correct, or you disagree and you have facts or information to back it up, you're more than welcome to put it in the comment section below. We're more than happy to hear this from you guys. Okay, so that's pretty much it. Thanks very much for watching. As always, this is I enjoy watching. Sorry. Thank you very much for watching. That's pretty much the show for today. Give us a thumbs up if you like the show. If you're listening to us on podcasts, make sure you give us a 5-star review if you enjoy listening to LTA. That helps us a lot in growing our content in the podcast realm. If you have any comments, suggestions on how we can improve our podcast, do also let us know. Please do subscribe to our channel if you haven't already. And if you have any comment suggestions, leave them down in the comment below. As always, thanks very much for watching. This is Amin.
This is Alex.
And that has been Let's Talk About. This is the 30th of April, 2020. Catch you guys later. And see ya. Bye.
Bye.